How you doing?
Hi,
How are you?
I'm great.
That's
Uh,
good.
uh, yeah.
Yeah. Great. So my name is Francisco. Oh, there we go. Yep. And
All right. My name is Dr. Hamza Yusuf, and I'm going to be your guide to help you make a diagnosis. So you can
okay.
see your patient, so you can go ahead and ask all the questions you want.
Okay. Hello. How you doing today?
Yana muku magana yana cewa hi din you can wake him. in kuna so. Yeah. Uh,
Um, what's your name?
me sunan yaron. Okay, his name is Lokchan Gideon.
Okay. Nice to meet you, buddy.
Mhm.
So how old are you?
Wai shekaran shi nawa? Okay, he's 4 years old.
He's 4 years old. Okay.
Yeah.
Where do you guys live?
A ina kuke zama? Okay, they stay in Yalwa district in Bauchi State, northeastern Nigeria.
Okay. So what brings him in today?
Wai me ya faru kuka zo? Hmm. Okay, so ciki fa. Okay, okay. He's been having this fever for the past 1 week with
You.
associated abdominal pain.
Okay.
Yeah.
Okay. And how has the fever been? Has it been going away and then coming back, or has it just been like staying there for a whole week?
Wai zazzabin nan yana nan ne throughout ko kuma yana zuwa ya je ya dawo ne ko ya yake? Okay. Okay. So the fever is actually on and off, and it's usually worse in the evening hours.
Okay. And the abdominal pain, how in the scale of 1 to 10, how much pain are you in from one being the least, 10 being the worst?
Wai idan aka ce ciwon cikin nan in kika yi rating din shi over 10, ko kaman nawa za ki bashi a ce 1 ne mafi karanci da kuma 10 ne fi yawa pain ne. So kaman nawa za ki bashi over 10? Okay. So say, actually she can give it a 10.
A 10. Okay.
Yeah.
Um, are there any other symptoms or just the fever and abdominal pain?
Wai akwai wasu other abin da ke damun shi ko kuma kawai ciwon ciki ne zazzaɓi. Okay. Okay. He actually has also been having or passing loose watery stools with occasional streaks of blood. And he also complains that if he is passing urine, he usually has some pain when he's passing urine.
Okay. So I want to do a blood test to see if there's any sign of somalia in there and
Like
just start off with
salmonella, right?
yeah, salmonella and just start off with that.
Yeah, great. So we actually did a viral test for typhoid fever for
Mhm.
Salmonella typhi, and it turned out positive for us.
It was what, I'm sorry?
It was positive.
Positive for salmonella?
Yeah, positive.
Okay. And then for the abdominal, I want to do the
We also did a rapid test for malaria that
mhm.
also turned out positive for the patient.
Okay.
Yes.
So that I'm saying my diagnosis is he has malaria and typhoid fever. So for the malaria,
Great.
so my treatment plan is to give him antibiotics. Make sure he stays hydrated, make sure he gets lots of rest, just to make sure he's building up that strength back up again. And yeah, just for the future, make sure if you're outside to wear long clothes, long protective clothes to avoid insect stings. And just to double check, making sure everything's clean, water's clean, food's clean before one consumes it.
Right. So wai yana so ya ce miki kamar yaron ki yana da typhoid ne, sannan kuma da malaria. Sannan zai ba da anti-malaria for the malaria, sannan kuma da antibiotics for the typhoid. Sannan kuma you should also make sure ya sha ruwa sosai saboda ya zama hydrated. Sannan kuma ya ke kiyaye cin abinci masu tsafta da kuma wanke hannu da kuma zama inda sauro ba su cije shi ba. Yeah. So I've explained all the treatment plan that you have for your patients.
Mhm.
Uh, I don't know if there's any other thing you also like to tell them regarding other preventive measures, or you're done.
Yeah, I also forgot to mention that in addition to the antibiotics for the malaria to add ATC in there as well. And um in the future to also prevent malaria, make sure one like sprays their room before going to bed, leaving it there for like 2 hours before actually going to bed to make sure that the spray works, and have mosquito nets if available as well. And to boil water if it doesn't come from a clean source as well.
Right. Wai yana so ku zama kun amfani da kun tafasa ruwan da ku sha, sannan kuma ku yi amfani da mosquito nets, ku yi fesa maganin sauro so that a tabbatar cewa it doesn't happen again a gaba ko? Yeah. So they actually appreciate everything that you've said about all treatment plan for uh, their sick child, and they're very grateful for everything that you're doing for them. So if you're all done, I think you can wave your patient goodbye and you can have a nice day.
Bye, buddy. See, I hope you feel better.
Yana muku bye bye.
Yeah. Bye.
Yeah, yeah.